Hi, and welcome to Health Workforce Australia's first report for 2012. Today I'd like to give you an overview of 5 key pieces of work that we're undertaking in 2012. The first of these is our clinical training funding program. The CTF is now in its second year of funding. Through this program we have supported a 9% increase in the number of health professional students in training across Australia and a 23% increase in clinical training days. We have contracts in place with over 80 organisations covering 200 projects. $211 million has been allocated for capital and establishment funding and over $190 million to support the ongoing training of health professionals right across Australia. The second piece of work is our Simulated Learning Environments, Educator and Technician Training Program. The National Educator and Technician Program will equip up to 240 trainers right across Australia. These trainers will further equip up to 6,000 clinicians and supervisors in the latest simulated learning environments, teaching and training methods. The $94 million Simulated Learning Environment program will improve the quality, the efficiency, the safety and the accessibility of clinical training right across the health system in Australia. The third program is our Integrated Regional Clinical Training Networks. Health Workforce Australia is establishing up to 25 networks across Australia. These training networks will bring together the higher education system, the healthcare providers, all those involved in the training of health professionals from professional entry right through to postgraduate. The networks will be responsible for planning, organising and equipping the clinical supervisors in our training system across Australia. The training networks will bring together the higher education and training sector, healthcare providers, in fact all those involved in the teaching and training of health professionals right across Australia. Their role will be to plan, coordinate, develop and ensure that there are sufficient clinical training opportunities for our growing numbers of health professionals across Australia. Agreements are now in place across all states and territories to provide $30 million of funding to ensure that our training networks are able to work together to better prepare health professionals for the future. The fourth area of work is aged care workforce reform. Health Workforce Australia is rolling out up to 30 workforce innovation and reform projects focusing on those who provide care to older Australians. This is an $11 million program focused on 4 key areas of work in caring for older Australians. The first of these is building up capacity and capability to administer medication safely in the community. The second is to build capacity and capability in the residential aged care sector. The third is a project to identify early signs of functional decline in older people. And the fourth is the workforce skills required for complex care coordination of older Australians. Our aged care workforce reform program will run over 18 months and will focus on implementing nationally successful workforce reform and innovation right across Australia. Finally, I'd like to encourage you all to have a look at our 2011-2012 work plan, which you'll find on the Health Workforce Australia website. Our work plan covers over 30 national programs of work in the key areas of planning, clinical training reform, workforce innovation reform and international health professionals. Health Workforce Australia looks forward to working with you to ensure that we have a skilled and flexible workforce for Australia.